Hi, everyone, and welcome to the Muslim Sex Podcast. Thank you so much for tuning in. I really appreciate your patronage, and I would love it if you could leave me a 5-star review because that really helps me. And if you could like and share this episode with somebody that you know that may benefit, your friend, your colleague, anyone, I'd really love you to share this podcast, especially if you find value in the Muslim Sex Podcast. Also, I'd love for you to subscribe to my YouTube channel and follow me on all my social media. Also, as you probably know, if you've been listening to this podcast, is that I have a practice that is now open in Chappaqua, New York. I see patients for menopause and sexual health, as well as regular gynecology. So if you are looking for a gynecologist that actually spends time with you, that has time to listen to you, then I would invite you to come and see me in my practice, and I'd be more than happy to take care of you. So make sure if you live in the New York area, or even if you don't, come and see me in my office. I'd love to meet you. And also, last but not least, is that I am hosting again my retreat in Morocco for 2025. So if you are looking for a gift for a family member, a friend, yourself, make sure you take a look at our retreat, the Love and Nourish retreat. It will be held September 19th through the 26th, 2025. Again, this year in Morocco, we will be visiting the same towns. We will be in Marrakesh and Essaouira. And as always, we will be providing information and lectures on menopause, perimenopause, nutrition, and also going for cooking classes as well as excursions. So don't miss out. I know a lot of people were sad when they missed out this past year on the Morocco retreat. So make sure that you go and visit the Love and Nourish retreat hosted by Caria Retreats. And now onto the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Hi, everyone. I am super excited. So welcome to the Muslim Sex Podcast. And you are listening to the year-end countdown where I count down the 10 most downloaded episodes. And today we're focusing on the 10 most audio downloaded episodes of the Muslim Sex Podcast. So I love doing this every year because I get to see what people are most interested in and kind of where their passion is and maybe what I should focus on for the upcoming year. So this gives me a lot of information, and I'm so grateful to each and every one of you that, listens and shares and likes my podcast, because then that gives me motivation to keep going and keep going on with this podcast, which is so important because we know that education is really the key to everything in life. And the more we learn, the more we're able to advocate for ourselves and for our health and for our sexuality, whether that's in perimenopause, menopause, or our reproductive years or whatever, right? This is why I do what I do, to empower and educate my listeners. So here we go. As always, this is not meant to be any type of medical advice. And today I'm just going to be talking about the top 10 most downloaded episodes. Of course, we're not doing medical advice today. And if you have any questions about your religion, please speak with your friendly neighborhood religious leader, because I am not a religious scholar. I am an OBGYN. So anyways, let's get right into it. So the number 10, so I count backwards. So don't fast forward to find out which one was the number one most downloaded episode. Okay, I want you to listen to all of them. And so here we go. Here's number 10. So the number 10 most downloaded episode we have is the one called Reframing the Conversation About Menstruation with the filmmaker Lena Light Pleoplite, which I just love her name. It's so, it's such a fun name.
Lena Lita Pleoplita, from what I remember.
Is it really? Okay. I think it's
She
Lena.
was great.
Yeah, she was great. So Lena Lita Pleoplita. Okay,
Great
so
guess.
yeah, thank you. So if you remember, for those of you that, and I'm not trying to shame anyone that didn't listen to it, but now here is your reason to go listen to it, right? So this conversation was about how Lena was talking about her new documentary, and remember, her documentary is called Periodical, and she was talking about how it's really important to reframe that discussion and trying to erase the stigma about periods throughout the world. And she talked about what was going on in different advocacy groups, and there's an advocacy group here that's trying to get rid of the period tax, right, on tampons and pads and all of this stuff. And she was talking about how it's really important to reframe that conversation and just really talk about how we feel about periods, and how really taking it out of the shadows really helps a lot of women. And we know that women throughout the world during their period, especially when they don't have anything to help them, like, tampons or pads, really suffer, and they have to stay at home, and they're not able to participate at work or, in college or school or anything like that. So really important for us to, help promote discussions about periods and menstruation. And also, she talked about, again, the period tax, the tampon tax, and why Lena Lee had made this documentary about stigmas, and to help start the conversation around menstruation, the menstrual cycle, and how important it is to talk about these subjects without shame. So, really important episode. And if you happen to miss it, it's okay. You can always go back and download the episode and see what I was talking about. So that is episode number 10. What was the inspiration for you to make this movie?
I don't have horror period story myself, which is shocking to some people because surely one has to make a documentary if they're suffering with something. I came to the idea of making a movie about menstruation, of all of the things, from sheer curiosity. At In my 20s, my period was just my period, something I didn't pay too much attention to. And one day I was just sitting and thinking about how fascinating we do all of these things on our periods. Like we run marathons, we work, we, run for a president.
Make
We do
documentaries.
things on our periods. Make documentaries, right? Go shopping, whatever. And some of us don't have the very easy time on menstruation. Some of us do. But the funny part was, like, we're not supposed to talk about it. And I was always like, what's the big deal? And I find the menstrual not supposed to talk about it is even bigger than not supposed to, out loud talk about going to the bathroom and doing, pee or poo in the bathroom, right? That's one kind of not talk about, but menstruation in general is just, we definitely somehow are naughty if we talk about it in public, which I'm like, what's in there? Why is it such a big secret? And then I looked into what's going on in the world, and it's like, every single major religion in this world deems period dirty. Which I'm like, what's so dirty about that? So kind of just fell into a rabbit hole of asking questions about what's up with periods. Like, what are we hiding? And so the longer I looked, the more clear it became to me that it needs to be a story to be told, because I found a group of activists who were fighting the stigma, who were fighting not talking about it, who were fighting period poverty, who were providing tampons and menstrual supplies to people who could not afford it. So then I was like, oh, there's a whole movement of menstruation happening in the United States right now. That's fascinating. So it just kind of kept on going organically, and it really changed my perspective of menstruation along the way as well.
All right. Number 9 is an episode that yours truly did. So it was an episode that I did on orgasms. And if you go on the YouTube most downloaded episodes, so that was number 2, by the way, number 2 for the YouTube episode. And on this episode, I talk about, so this was during, I don't know if you remember, but in February, I focused completely on sexual health. So this episode was on orgasms. And we took a deep dive and focused on sexual health and about orgasms this time. and what exactly an orgasm is, what it, what it constitutes an orgasm, and what types of orgasms women experience as opposed to men. And we talked a little bit about the orgasm gap, which I probably will focus again on another episode in February. So keep your eyes open for that one, about what exactly is the orgasm gap, what does it mean, and how do we fix that gap. And so, we talked about the anatomy, we talked about relationships, we talked about mental health issues, because it's not all about just sex, right? It's also about, we know that the biggest sexual organ is, of course, the brain, and how it's really important to be, really in tune with what's going on and really be present. And of course, I love Dr. Lori Brotto, and as you know, I mention her all the time, and she has written that book, Better Sex Through Mindfulness, and she really talks about being present, right, in your relationship, but also during intimacy. And when you're having, when you're being physically intimate with your partner, and how important it is to be really in tune to what's going on physiologically, so that you can experience more desire and increase your libido and arousal, and also lubrication in women that practice mindfulness. So that's what this episode was all about. So if you missed it, again, go check it out. It was on my sexual health series, Sexual Health 101, and this was in regard to orgasms. So orgasmic disorders can definitely lead to distress, frustration, feeling of shame for both the person experiencing it, and then of course for their partner, because then their partner thinks, well, they're not able to give their partner an orgasm, whatever, and they're not enjoying it, and it's not pleasurable. So there's a lot of things, I would say, a lot of mental drama going on in both of the partners' minds around, a person not being able to experience an orgasm. All right. So the number 8 most downloaded audio episode for the Muslim Sex Podcast was by Dr. Avram Blooming. And it was about menopause and estrogen, and how important estrogen is as women go through midlife and into perimenopause and menopause, and the effects of estrogen on our bodies. And as you know, Dr. Avram Blooming is a medical oncologist. He is based out in, I believe it's in Southern California that he is. And he talks about the need for sex-specific research in medicine to debunk the common misconceptions that we have regarding estrogen and hormone therapy and what it means. And really, there was that whole axiom that a lot of physicians learned, which was the lowest dose for the least amount of time. And he really delves into that and talks about, why is it that we say that? You really don't need to say that. And that's really not relevant. And that's old information. So a really important episode, especially if you are in perimenopause, menopause, and you're considering menopausal hormonal therapy. Really important episode for you to take a listen to. And of course, he has a book as well. So check out his book, which is called Estrogen Matters. This episode, of course, dives deep into the significant steps being taken in women's health and what he's doing to advocate for menopausal hormonal therapy, but also why it's so important, and does, estrogen really cause breast cancer?
In 2003, a year after they came out with their blockbuster misinformation, said hormone replacement therapy has no effect on general quality of life. And they published that in either the New England Journal or the Journal of the American Medical Association. And the first question my wife asked is, what planet are they living on? And when you read their article, they make it very clear that they knew that symptomatic women who were randomized to placebo would know within a week whether they were taking hormones. And so they intentionally prevented symptomatic women from joining the study.
Wow.
And so if you read their article carefully, what it really says is, and so when we looked at these women who had no symptoms, we found that giving them estrogen had no effect on the symptoms they didn't have.
Right.
But the New York Times headlined that not only do hormones do all these bad things, they don't even do the things we thought they would do. We know that and there are numerous articles that support this, that about somewhere on the order of 30 to 40,000 women who develop hip fracture as they age will die within the first year following the hip fracture.
Wow.
That's close to as many women who die each year of breast cancer. And the single best treatment to prevent the osteoporosis associated with eventual hip fracture is estrogen. And it works better than any other treatment we know of.
All right. So the number 7 most downloaded audio episode for the Muslim Sex Podcast is the episode on the power of emotional intimacy, which is so interesting, with and cognitive behavioral therapy with Dr. Sanjana Kareem. So on this episode, this is where I talk to Dr. Kareem about cognitive behavioral therapy and its approach in sexual health, and why involving a physician and or a pelvic floor therapist can be beneficial, and how things like trauma, fear, and sexual dysfunction can be addressed with cognitive behavioral therapy. So, and a really important episode on promoting emotional intimacy in a relationship, especially if there's any type of trauma or a history of trauma. Really important episode. So make sure you check it out. I'd love for you to explain perhaps the psychodynamics of what exactly is going on and how cognitive behavioral therapy, because that's usually what I use to help patients that have these issues, but I'd love to hear your take.
Sure. I mean, vaginismus and a lot of intimacy-related physical challenges are a really good example of the duality of the mind-body connection, right? There's a psychological and a physical component to this. And this is a very common issue I see, not just in the Muslim community, but in general amongst women. And there's very often trauma associated with it. There's sexual trauma, and then also there's women who've grown up to or come up in society or in their families to have a negative understanding of sex sometimes, and that can become very challenging when they're in a marriage and when they're in a sexual relationship.
All right. So number 6, and following true to what my whole podcast is about, right? It's about sexual health, sexuality, libido, menopause, perimenopause, but the Muslim Sex Podcast does focus a lot on sexual health. So here, number 6 is the episode with Cindy Eckhart, and she is fantastic. I love her. And this is the episode where we talked about low libido in women and what are the therapies out there, reclaiming your desire, and the pink pill. So as you remember, Cindy Eckhart is the CEO of Sprout Pharmaceuticals and the company that makes Addy, which is a medication that is used for low desire. It increases the dopamine in the brain and helps with the neurotransmitters that are responsible for desire and libido. In this episode, you can find out why Addy is what Addy is, and of course, its impact on women's lives and the importance of prioritizing women's sexual health in a medical system that often overlooks it. And we know that women's health definitely does not receive the dollars that men's health does. And so really important discussion that we had there. In addition, we also talk about the biopsychosocial model and where Addy fits into that. And also, in addition to this, is the amazing breakthrough that Addy had. And it was the first medication that was approved for decreased libido in women, and it was approved in 2015. So this is such a fantastic conversation. And so if you are interested, make sure you go look it up, download that episode, and take a listen to why it is so fantastic.
This stat will make your audience upset. 4% of the research dollars go to women's health.
4%.
2% go to prostate cancer alone, just as a comparator. So if you think about it, women weren't included in clinical trials until 1993. We have a healthcare system that has really ignored a lot of the biological needs of women. And that's what really ignited me. I mean, I know we'll talk about this biopsychosocial construct to sex, and if you imagine that as that Venn diagram, social factors that come into play with conditions like this, how we were raised, religion, everything that you talk about so eloquently, the psychological factors, how we feel in our own body, body image concerns, relationship dynamic. But what was crazy to me was that we had this discovery and we were just ignoring biology. So we would say to women like, oh, it's just stress. It's just have a bubble bath. It's just buy some lingerie. It's just, and I felt like every time I was hearing that, it was placing this blame on women when in fact it is possible that it was just a neurotransmitter issue. And that's what we were seeing in these brain scan studies. So for all the reasons you say why women's health can so often be dismissed, that was really my complete drive to see this all the way through and across the finish line. When we broke through with this product, to your point, we were the first in the world. And, we were early. Like, I think it's taken a bit for culture to catch up and be able to have this conversation. We're still not there, right? But thought leaders like you are leading the charge of making sure we're discussing these issues that deeply affect our lives.
The number 5 most downloaded audio episode that we have is actually another episode by yours truly. It's the one that I did in February about Sexual Health 101. And it was the one on intimacy coaching and sensate focus. Oh my God, you know how much I love sensate focus. If you listen to any of my episodes, I either talk about mindfulness in relationships and how that impacts desire and libido. And I talk about sensate focus because I think those are the two most important modalities we have, honestly, when it comes to coaching, when it comes to sex coaching. I know there's so many, but of the ones that I know of, I feel that sensate focus and mindfulness are two very, very important modalities. So this episode was about sensate focus and intimacy coaching and how sensate focus it can be integral in intimacy coaching. And I often tell my clients to try sensate focus, especially if they have a lot of negative beliefs around sexuality and if they have a hard time with sexuality, and also if they have been in a sexless relationship. Really important, because the sensate focus really helps people to get back into their bodies, but also kind of restart the process again of discovering their own body and discovering somebody else's body. So I think it is such an important episode, and how the two just go in so very well together. I mean, they just, it's kind of like pieces of a puzzle. They kind of go really well. This episode also goes a little bit into the basic understanding of the body, the physiologic responses during intimacy, and why it's so important to work with professionals that understand that connection. Intimacy coaching is, I feel, is very important, especially if you have been raised in a sex negative environment or in a lot of sex negativity. And so in order to become sex positive, I really feel like you have to go to like a sex neutral place where you are at least open to connecting with somebody. And then from there, go to sex positivity. So anyways, if you haven't listened to it, make sure you download it and see what you think, and let me know and DM me and tell me, did you think it was good? Did you not think it was good? But definitely sensate focus and intimacy coaching are kind of like peanut butter and jelly, kind of go really well together. So let's focus now on sensate focus. What exactly is it and why is it so great? Why do I love sensate focus? So I've talked about sensate focus before, and I spoke a little bit about it during the Vaginismus podcast, but sensate focus is really a technique that is used to improve intimacy and communication between partners around sex and different types of performance anxiety that people may have, right? And it goes away from being really goal oriented to really just experiencing intimacy for the sake of intimacy, for the sake of exploration, for the sake of just pure enjoyment of yourself and not really for anything else except for that. This is great, I feel, especially for people that have never been intimate with anyone ever. So say it's, so if we're talking about Muslims are not supposed to be intimate outside of marriage. So let's say that, it's your wedding night, right? And you are really anxious and you're really worried and you don't really know. Well, first things, what I would suggest is get familiar with your anatomy and the anatomy of, through books and whatever, maybe an educator that knows about sexual health. Really try to understand the anatomy of yourself and of your partners. And then I would say that, the sensate focus is fantastic for that, because what happens is that you're not, there's a lot of pressure, I think, on new couples to have intercourse right on their wedding night, which I don't think is really a great idea, especially if you're not familiar with the anatomy and you don't know what you like and what you don't like. And I think that it just puts unnecessary pressure. I think that you can kind of prolong it. And what helps with that is using this sensate focus, right? So what you're doing is your goal is not to have this, penile vaginal intercourse the first night. The goal is to just get used to each other's bodies, to get used to the texture, the pressure, the feel of that person, and then slowly make your way through, right? So you're not putting all that pressure on you that first night to have intercourse, because it just may not happen. It may not work. You may not, it may be too painful. You may experience vaginismus. Your partner may have erectile dysfunction. I mean, there might be so many things that are going on, right? Everybody may be so into their heads that it doesn't really work out. So that's why I think the sensate focus is really helpful for individuals that it may be their first time, or for individuals where they have experienced trauma or abuse. This is a really great way to get back into becoming physically intimate with somebody. So the number 4 most downloaded episode, and of course, staying on brand, this is the Muslim Sex Podcast. So the number 4 most downloaded episode is Becoming Clitorate. And I love Dr. Lori Mintz, as some of you know that may have listened to this episode. This episode is all about really understanding, the clitoris and its function in female pleasure, and understanding the orgasm gap and what it is and how that plays into effect in heterosexual relationships, and how important just knowing about your own anatomy and what gives you pleasure, and realizing that the clitoris is really the only organ in either the male or female body that is solely for pleasure. So really important episode. Again, Dr. Lori Mintz is a psychologist. She is in Florida. She's a psychology professor and human sexuality expert. She's given 2 TED Talks. She has thousands of followers on social media, but more than that, she has so much value in all of the things that she puts out there. She has 2 books. One of them is Becoming Clitorate, and that's what the episode was called. But she has another book coming out, I believe next year. She's working on her 3rd book. So that is fantastic. And, really important, all the things that she says. So she talks about her expertise to discuss women's genital anatomy and sexual pleasure, and explain the pleasure gap and what that means, what it means to really be clitorate. So such a fun episode that I had with her. So take a listen if you haven't already taken a listen yet. And I'm an OBGYN. So imagine other specialties, like they're not getting any either. So I think that there's just a real systemic problem that we have.
Yeah, it's so sad to me, right? And, I didn't get any training in, becoming a psychologist on this. They still don't do any training. And I've started doing grand rounds at a lot of medical schools on sexual health, and not the medical stuff because I'm not trained, but just the conversation,
Yes.
just like simple things you can teach patients, like about responsive desire, which is having sex without being horny and letting the touch get you horny, like vibrators and why they work and how they're empirically supported, and how to talk to patients about it. And these residents are so grateful. And many come up to me and say these 45 minutes were the first time in my entire training. And these are OB-GYN residents that they're,
I believe it. Oh, no.
and I'm like, and you all are the first line of defense. I know many of my patients will say, the first person I talked to was my gynecologist, and not everybody's lucky enough to have a gynecologist like you who knows, so many times they're told, pain's part of it. Have a glass of wine, relax, it's, and so your patients are so lucky, but so few patients have access to that kind of care.
And I will tell you that just have a glass of wine. I can't tell you how many times I heard that in residency, right? So if a medical assistant or somebody would come out, and I was in residency and I didn't know anything about sexual health. And so they'd be like, oh, or even during, when a woman is in labor and was so uncomfortable being checked, or, they'd be like, oh, you just need to relax. You just need to, patient doesn't relax when you tell them to relax, right?
No, you cannot relax on cue when you're in pain, especially.
Right, exactly.
And you know what's really interesting about that have a glass of wine thing? A lot of research that I've just been reading recently, people are told relax, right? That's why you might not orgasm. But it's just the opposite. Orgasm, as you well know, is due to blood flow.
Yes.
And so many times going out for a run and getting the blood flowing is more effective than having a glass of wine. And I don't have anything against wine, but wine, a glass of wine is going to make you feel a little more relaxed, horny in your head, but it's actually a central nervous system depressant, right? So it's not going to help with the blood flow, so we're not only like dismissing women's pain and upset, but we're kind of giving them bad advice too, right?
Absolutely. Number 3 most downloaded audio episode is with Dr. Charu Ramaprasad. And this is the episode on intimacy after sexually transmitted infections, which I think is another important episode. I mean, honestly, I love all my episodes. That's why I have these guests on. But this was such a good episode because I think a lot of people feel a lot of shame and stigma and after they may have been exposed to a sexually transmitted infection. And so this episode is really about, how to move past that shame and how to then be intimate again, right? Safely with your partner. And she's an infectious disease doctor, if you remember, and she talks a lot about her experience with HIV patients, but also those patients that have been exposed to gonorrhea, chlamydia, HPV, which we know is super common. But if you have been vaccinated against HPV, that will prevent even if you've been exposed to the HPV virus, hopefully that'll prevent the disease from progressing over to cervical cancer. And we know that the HPV vaccine is so, so good, and we have so much data on it. So if you or someone has been offered the HPV vaccine, really consider it because it does save lives, and it is really good at preventing people from getting cervical cancer. So really good. Also, we learned in that episode about the importance of STI, being tested and also treatment. So an important episode. If you didn't hear it, go ahead and download it and take a listen.
So most adults will be seropositive or test positive on the blood test for herpes simplex virus 2, which is what I'm guessing people are often upset about.
Yes.
And so, and I think it's an understandable desire to be tested because people want to know what's in their body or what they've been exposed to. I think the situation that becomes really tricky, at least for me, is when patients have never had an outbreak of herpes simplex virus 2. So they've never had any genital lesions or genital sores, but then they have a blood test that's positive. And there have been many articles written about this. I won't review all of them for your audience today, but the challenge is that the interpretation of that positive result depends a little bit on the pretest probability of that patient having herpes simplex virus 2. So there is a false positivity rate to almost every test, including serologic tests. And so what I usually tell patients is we can test you for HSV2 if you want us to in the blood. And if you've never had an outbreak, I want you to think about what you're going to do with that information before we do this test. Because depending on the type of person you are, you may or may not feel compelled to act on that information. But it's a very difficult clinical place to be in, and it's a difficult place for patients to be in as well.
I love that you ask the patient, what are you going to do with this information?
Yeah.
Because, I think that a lot of times, I can only speak from the experience I have with my patients, is that they will totally freak out. They'll be like, oh my
Yes, it's
God,
very
I
alarming.
got this. And, where did I get it from? How long have I had it? What if and it just, and then you have to just really, calm them down and and say the things that I would normally say to help them feel a little bit better. And and then of course I say that if you ever have an outbreak, where you have these blisters and water filled sores in your genital area, then give us a call, we'll give you medication. And also I have to remind them that it's when they have an outbreak, definitely not to be sexually active, but that,
Yes.
Genital can become oral and oral can become genital. And, there is some shedding of the virus, even if it's not active.
Yes,
right?
Absolutely. Absolutely right. And I think that's one of the hardest things for patients who have had an HSV2 outbreak in the past is they want to know how to not experience pain and discomfort themselves, but they also want to know how to protect their current or future partners. And I think that's exactly where what you were saying, patients can approach their healthcare providers or their physicians about either being on episodic treatment, so treatment just when they get outbreaks, or being on suppressive treatment. And that's something that I think probably is underutilized a little bit in this country. And so that's something that people can sort of, if they've had more than a certain number of outbreaks every year, can certainly go on with that sort of desire to protect their partners if their partners are negative.
The number 2 most downloaded episode is audio episode is another one that I did. So, you may be thinking, I wonder if she picked her own episodes. But no, we have data behind it. And we went through and just looked at what were the ones that were, downloaded the most. So you can't make that stuff up. It's obviously what people are interested in. So I appreciate the viewers and the listeners out there for picking 3 of my own podcasts that I published on sexual health, because I know that that is something that is really important, something that we don't get enough of, and something that not many clinicians know about. So I think it's really important. And so thank you to all of you that have downloaded my episodes, that have shared it and liked it, because it means a lot. And it means that you also are promoting sex positivity and sexual health advocacy, which is so important. But so the number 2 most downloaded episode is Sexual Health 101, Understanding Vaginismus. So, I'm not really surprised, to be honest, that this is, the number 2 most downloaded episode, because I think that a lot of people suffer from vaginismus. And I think that, there's just there aren't that many resources on it. And also it's something that goes under the radar. I think that, what happens is that women are experiencing vaginismus and then their clinicians either dismiss them or they tell them, try to relax, try to breathe. And, none of those things are really helpful, especially when you are suffering from a tight pelvic floor and really the fear of penetration. So I think that vaginismus, the topic, is super important, because there's a lot of women suffer from this, and a lot of marriages, can dissolve because of this. And also so many unconsummated marriages because of this. So really, really important topic. And why, this episode was important, because it's focused on why it was so important to break the stigma associated with vaginismus and the different types of modalities and treatments we have to help people that are suffering through this, and the multitude of ways that it can affect women. And, like I talked about before about sensate focus. So one of the modalities that I use for vaginismus is sensate focus and definitely mindfulness. So 2 of the ones that I always talk about. are the modalities that I use for this, because I think that a lot of it, when we're talking about the emotional and psychological component of vaginismus, you need a little bit of a stepwise approach to how we deal with this and how to make women feel more comfortable with, with penetration. If that's something that they want in their relationship, then I think it's really important for us to discuss ways that they can manage it. Oftentimes, vaginismus is a problem that results only after, especially in a lot of the Muslim communities, after somebody gets married, right? Because a lot of times, well, we are, as Muslims, we're not supposed to have relationships or sex outside of marriage. And so oftentimes we don't see it until after somebody gets married. And so just to kind of go over once again, what exactly is vaginismus? So it's basically the body's automatic or reflexive reaction to the fear of some type of vaginal penetration that may happen. So it could be, due in anticipation of an exam by your healthcare provider. It could be due to trying to insert a tampon in. It could be due to the anticipation of fear due to penile vaginal intercourse. And any of those things could result in the muscles surrounding the vagina to tighten up on their own. And so it's just a reflex response that happens. And most of the time you don't have any control over it, because what happens is that your mind just kind of takes over your body. And we know, as you've heard in a lot of my episodes, that the brain is the biggest sexual organ that we have, right? But if your brain is already anticipating pain, then the muscles that are surrounding the vagina are going to react and they're going to tighten up. It doesn't necessarily affect your ability to get aroused or enjoy other types of sexual contact, but oftentimes women that suffer from this tend to feel as if their partner is hitting a wall, or that they feel so frustrated or perhaps embarrassed or ashamed that they're not able to have penile vaginal intercourse. There are two types. So there can be some women that normally have been able to have intercourse and now for one reason or another are not able to have it anymore. Or there is primary, for when a woman experiences pain every time something is entered into the vagina, including penetrative sex, or it could be, an exam, or it could be a tampon that they're trying to insert. Most recently, I actually had a patient come in, and she was 48 years old. She had had two previous children, vaginal deliveries, and really never had this problem. And then all of a sudden, she's going through perimenopause, and now she starts experiencing these symptoms of where her muscles around her vagina are starting to tighten up. And she's experiencing this, what we call secondary vaginismus. And she's not really, sure why she's going through it. And it's so interesting because she came to me as a referral from another doctor, and she came in just with the diagnosis of pain with sex. And, there can be several reasons of why somebody has pain with penile vaginal intercourse, but nobody actually sat down with her to go over, what could be causing the problem, when did it start, how long has it been going on, what are the things that cause this, or cause this type of reaction to happen within her body. So really interesting. And so the number one most downloaded episode, and actually this is both for YouTube and for the audio downloads, is female sexuality in Pakistan. So really interesting that was the most downloaded episode, because I think that people are curious, right? People want to know what is going on. Either if you're not Pakistani, perhaps you were just curious to find out what's going on in other countries. But this is, it's not something that is hearsay or made up. This is by a professor out of St. John's University in Queens, New York. And this is Dr. Sakina Jungbar. And she talks about female sexuality in Pakistan, and she was raised there and she grew up there. And she talks about the research that she's also done. So it's not just, about her own experience, but it's about the research that she's conducted regarding sex education in Pakistan, is, female sexuality and kind of how that's manifested. And she talks about, sharing her own experiences as a Pakistani woman and her expertise to help break down the current state of female sexuality within Pakistan and Pakistani culture. So, I think it's really intriguing for me to realize and to know that people are really interested, right? We're interested in kind of how others live, how they experience sex education in different countries, and what are they learning, right? And what are the stigmas and the cultural norms, and also how do we break that cycle of sex negativity? How do we go to a place of more sex positivity in different cultures and traditions, right? Is that something that we can do? Is that something we can work on? And I think it really starts with open communication. It kinds somebody once said this, and I think it makes a lot of sense, is that when you shine light on shame or on a topic that's shameful, what we think may be shameful, it's no longer shameful, right? So sexual education, I don't believe it should be shameful, when it's done with respect and when it's done with, without vulgar or obscenity. I think it's really important because this is how we all got here, right? And it's really important for us to understand, how can we move forward as a society? How can we break the stigmas that we have? How can we break the cycle of not teaching our children about sexual education, right? How do we do that? Even if we grew up with sex negativity, or even if we grew up in a culture or community that never discussed sex, or maybe, where it was taught as wrong, shameful, dirty, and then you get married, or, you're in a relationship or whatever. And all of a sudden, how do you go from that to becoming sexually active without having all of those thoughts in your head and carrying all that baggage with you, right? How do you get rid of that? And how do you transform it into something more positive so that you can move forward in your relationship, but not even just in your relationship, but also just with yourself, right? How do you give yourself permission? And I think that that's what I try to do with my episodes, with my podcasts, so that it gives you permission to learn and then to advocate for yourselves, and to grow as a human being, right? Because it's really important to grow. We have to have that growth mindset. So anyways, that's my little spiel on why sexual education is super important. And I think it's important for so many reasons, right? To prevent intimate partner violence, to promote sex positivity, to help people live more pleasurable lives, right? The whole point is to help women and remove emotional and physical barriers to experiencing pleasure in their relationship. And that's really what I enjoy doing. I enjoy providing this information to you all so that you can learn and grow.
I remember I was in college when a friend of mine had a sister who went to medical school. And then she came and she was whispered in my ear one time in class that she said, "Do you know we have two separate holes, one for pee and one for blood?" And my mouth fell open. I was like, what? Even basic education like that, we don't have. And the reason for that is, I think when they want a woman to be innocent, they don't only mean virginity or lack of experience. They also want you to be innocent in any carnal knowledge, any type of knowledge. It goes together because the culture has this view that if a woman has knowledge of these things, then it must be that she is not pure. She's not a good woman because she has all of this knowledge. And then where did she get it from? It's not considered medical knowledge, or it's not considered education. Knowledge in itself is seen as suspicious. So that innocence is hard. Like when you get married, you're not supposed to know anything. And, this is not in my research paper, but these are just some thoughts I have, that it's not how women are not given access to knowledge is not accidental. I think it's by design, because what does knowledge do, Sadaf? It empowers women.
Yeah.
Right?
Mhm.
Because if you know something, then you know when it's not right, or you know when it's wrong, or doesn't feel good, or if someone tries to manipulate you, your knowledge tells you that this is not right.
Yeah.
And when you don't have it, then you're at the mercy of your husband tells you something, and then you have to take that as true, because there's no other way for you to know anything.
Yeah.
And I'll give you an example. I hope it's okay to talk about that.
Yeah.
But this is when I was really young, and there was a long gap after I did my 10th grade matriculation, and before college starts, there's almost like a year before your results come out. And there was a lady in the neighborhood with whom I used to take some tuition when I was younger, and she had started a school. And she asked me if I would like to teach in her school. And I was just 16 at that time. And I said, okay, why not? I'll make some money. And there were a lot of older ladies there. I was really young. There were women who were married with children. And this one lady, she told me that you have to perform oral sex. Her husband told her that that's the only way she can have a baby.
Wow.
And she really believed that to be true. And I didn't think so, even though I didn't really know, but it didn't seem right. But she totally believed that. And I was like, okay, now looking back, like that story has stuck in my mind, even though it was like 35 years ago, that this is how you manipulate women. Because if we don't have information, then we become subject to whatever information is being fed to us. Because education equals empowerment.
So that is it. Those are the 10 most downloaded audio recordings for 2024. And I hope that you will continue to listen to my podcast. You know, I'm trying to get to 100,000 podcasts downloads. So if you could help me with that, if you could like and share my episodes, if you could share them with somebody that may be going through a tough time, maybe they're experiencing vaginismus, maybe they're having a lot of mindset issues, you know, maybe share the episode with them, and then DM me and tell me what they think and tell me what you like. I'm always looking for suggestions for future podcast episodes. So please, you know, reach out, email me, DM me, whatever. I'm on social media, and let me know what are episodes that you are interested in so that I can bring that information and content to you. And so, as always, this is not meant to be any type of medical advice. So if you have any questions about your sexual health or any type of health, please speak with your healthcare provider. This is not meant to be any type of religious advice. As you know, I'm not a religious scholar and I don't pretend to be. So please go speak with your friendly neighborhood religious leader. And I hope that you will continue to listen to my podcast and share them and like them. And please leave me a Google review. I'd love for it. For you to leave me a 5-star Google review. And that's it. Until next time, I'll see you in 2025. So thank you so much. And make sure you go and listen to all these episodes. Until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.